What's up, everybody? It's Justin here with CBG Radio, and I have a special guest on today named Erin Comollo. She is the Program Development Administrator for the New Jersey Healthy Kids Initiative and the Institute for Food, Nutrition, and Health at Rutgers University. Additionally, Erin is a CrossFit Level 2 trainer and has her CrossFit Kids certification. She's worked with individuals, small groups, and children to develop healthy lifestyles that focus on fitness and nutrition. She's going to be talking to us about a lot of things related to childhood obesity. So Dr. Erin Comollo, how's it going?
I'm doing great. Thank you. Yeah, very excited to be here.
I'd love to start with, what is the current state of childhood obesity in the United States?
Roughly 1 in 7 children in the U.S. ages 10 to 17, or about 15.5%, have obesity. And I think there's even more statistics coming out about what's happening now with COVID and how that is impacting those statistics. But as of 2018, 2019, those were the current stats.
So why do you think this has become such a problem for children and teens in the U.S.?
It's a combination of factors. A huge factor in it is certainly the foods. You mentioned McDonald's that we eat outside of the home. Portion sizes and caloric density of foods have increased as food science has evolved and developed, and in some cases has evolved as a result of making food more accessible and affordable. There's also that flip side of making energy dense, cheap, non-nutritious foods available and plentiful and in large portions. So that's one. Also, kids have a lot less physical activity. There's so much more screen time. I think not just for kids, adults. I think we've all experienced that, especially during COVID. Neighborhoods that don't offer safe spaces for play or walking, so lack of sidewalks or green spaces or parks. And then the school environment. So I know even as a teacher, I can attest that academics came first in certain settings that I was in. And if you didn't get something done, it was going to come out of the recess time. Or, if there wasn't a gym teacher or if it was raining, they probably weren't going to get their actual gym or vigorous physical activity time during the day. So I think priorities in education and child rearing have shifted, where you may have had an actual physical human being interacting with your kids, doing things where they're moving at home. A screen has become a babysitter. So I think those are huge contributors. And then we can't overlook some of the social determinants of health as well. In those statistics of obesity rates, we have higher incidences of obesity in Black and Hispanic populations. So it's 22.9% of Black children ages 10 to 17 are obese or overweight, and 20.7% in Hispanic populations. So, it also leads you to think that while there are these environmental and behavioral factors, there are also these structural racial inequities that are impacting on top of those other factors. So sometimes it does feel a little bit like we talked about the genetics and then the epigenetics, and then layered on top of that is the environment. So I think that's a huge deal, as well as putting those both together, the issue of food insecurity. And then that kind of goes back to those social determinants of health as well.
I resonate with that a lot. I think that you hit it right on the nose. Can you explain what food insecurity actually is?
Basically, do you worry about where your next meal will come from, or that you'll be able to afford your next meal? It's basically as simple as that. And food insecurity can come from anywhere due to financial issues, but it's also linked to things such as food deserts. So perhaps you live in an area where access to healthy food is very scarce or hard to get to. Maybe you don't have transportation to get to somewhere that has healthy food access, or there's even a term food swamps, where perhaps you live in an area where there are ample opportunities for food, but they are all McDonald's or local bodegas or 7-Elevens, where you're just getting these packaged calorie-dense foods. And this is kind of what we talk about when we say there's the double burden of malnutrition, like you said. It's this combination of being overweight and obese, yet still suffering from undernutrition. You could be eating a lot of calories, but not a lot of nutrients.
So you are the Program Development Administrator for the New Jersey Health and Kids Initiative. So what is New Jersey Health and Kids doing to help determine and aid in a response to this epidemic of childhood obesity?
Our initiative is really 3 different arms that we were tasked to do to help build a culture of health from the Robert Wood Johnson Foundation, who funded us. The first was to really build a robust community advisory board and scientific advisory board so that we're engaging stakeholder voices, making sure that we're using best practices and up-to-date science, and really collaborating with others who are interested in this field. The second was to take all that we're learning, take what all researchers are doing in the field, and put it out there for other academics, practitioners, community members to engage with. So we host a symposia series. We've hosted 5 so far, and they've ranged on everything from childhood nutrition to systems data and how can we use a systems approach to child health. And then the last, as you alluded to, is my primary role, which is working with schools. And our goal is to help schools improve their policies, systems, and environments relating to nutrition, culinary literacy, and physical activity. And the reason that we really focus on those policy systems environments is because research has really shown that's the areas that you can inflect the most change. Programs are wonderful. Environment is wonderful. Systems in itself are wonderful. Policies, take a lot of work to get done, but can be very impactful. But it's really not until you tackle the 3 as a whole that you can really get systemic change.
Yeah, it's good to obviously take a multifaceted approach to this problem. What can mothers and fathers and even kids be doing better to get healthier meals for breakfast and for dinner, as opposed to what they're currently out there doing, which is either ordering out or packaged foods?
So one of the big things that we really promote for families at home is really engaging kids in the kitchen and just in the whole process of food in general. One of my colleagues has this really great saying that watching cooking is not the same as doing cooking, like watching the Food Network or having your kids watch you cook in the kitchen. And an example of that I can give is, after a day of watching the CrossFit Games, how much better is your personal skill set, right? What we need to do is give kids an understanding of where their food comes from, what goes into making food, preparing food, and just engaging them in that whole process. There's been a lot of research that shows that by teaching kids to cook, they will shop differently, fill their plates differently, even consider their impact on the environment differently. And I can tell you firsthand, we've done a lot of different cooking and food literacy work with kids all through different age groups. One really great example is that we helped fund some aero gardens in a preschool that we work with, and they grew some tomatoes and cucumbers. They even tried to grow some strawberries, but what ended up growing most plentiful were leafy greens and herbs, which probably, if you ask most adults, does not strike them as what kids would want to eat. But because the kids were part of that seed to plant process, they planted the seeds, they observed the seeds growing, they harvested their greens and their herbs. We used them in cooking lessons. Every single kid in that class was willing to try those leafy greens and herbs. In fact, some of the kids even went home and requested that their family try buying basil or add it to a dish. So I think that's proof right there that kids, when they feel empowered with the decision making, they take ownership of that. On the flip side, when I was in the classroom, I did a whole year-long study with my co-teacher with the kids on cacao and cocoa farming, and we talked a lot about the bean to bar process of chocolate. And as a result, after the kids realized what a painstaking process it is to get 1 bar of chocolate, how much work goes into it, how a lot of the workers, the harvesters and farmers never even taste chocolate in their entire life, they said, wow, I would gobble up a bar of chocolate, but now even just taking 1 bite, I think about how much went into that 1 chocolate bar. And their families would come back and say, my children are more conscious consumers, we'll look for certain labels on our chocolate when we buy it to make sure that it's environmentally sustainable. And there's just so much that we can involve them in and empower them with to make these healthy choices, as long as they're kind of on the grounds with us from the very get-go.
Keep tuning in every week for more incredible guests. Don't forget to check us out at consistencybreedsgrowth.com or on Instagram at CBG_online_sports. Also, feel free to join our Facebook page at facebook.com/groups/CBG Nutrition Tribe.